that is new, but instead there is nothing new about vertical preparation. Hi guys, I am Marco Maiolino. Welcome to this short webinar about vertical preparation. Vertical preparation seems something that is new, but instead there is nothing new about vertical preparation. In Italy, we are doing this kind of preparation since 1970s. And if you look at the history of vertical preparation, you will see that vertical preparation have always been everywhere, okay? So there is nothing new about vertical preparation. We have articles starting from the beginning of the century in the United States about vertical preparation. It's just that the material in the past were not good enough, were not the good one for working with vertical preparation, and we had not the good protocols, the right protocols. In this moment, so I can divide the vertical preparation in three distinct periods. The 1.0 is the old vertical preparation. The 2.0 started around 2009-2010 with the use of zirconia. The use of zirconia changed everything about the use of vertical preparations. And the vertical preparation 3.0 phase started with us, with Tomorrow Tooth in 2017. Because vertical preparation was already an amazing protocol, far more better than horizontal preparation, but now, with the latest advantages that you have been able to give to this protocol, now it's perfect. So, what is changed in 2017? In 2017, we have changed many things about the original, the conventional vertical protocol, and we have changed, and now we have three more advantages. The first one is the bar protocol. You will see that you have moved from the conventional flame to another kind of bar. And we have been able in this way to obtain a protocol that it is easier, it's faster, and we have a different kind of versatility because we can move between a minimally invasive protocol to the conventional protocol. Using the minimally invasive protocol, we are able to save the enamel, the wall dentin core and the enamel on our abutments. And these are so many advantages. The bar protocol, this is what we have done. We have moved from the flame bar, we have done this kind of evolution, and now we are using the bar with a lot of clinical advantages. And we have started to work with very thin zirconia monolithic crown. This is another kind of crowns. I don't know if the name crowns is still a good one, okay? Because they are thin. Because we have changed the completely lab approach, now they are also reliable and they are really a rule breaker. Because when you are able to work on a tooth, keeping the enamel, this kind of restoration are challenging indirect bonded adhesive restoration nowadays. And this has been possible to work with this kind of vertical crown. It's possible because we have developed a completely new lab protocol, especially for managing thin crowns, but also for managing conventional ones. And this is the first lab protocol especially designed for vertical preparation, because you will see that working with vertical preparation for many reasons is completely different from working with horizontal preparations. So let me introduce myself and my partner, Dr. Pasquale Venuti. We are the founders of the Tomorrow Tooth group. We did this group in 2014 because we were tired of going at courses and congresses and looking always at the best cases. Best cases are nice to see. It's like when you go at the cinema. It's something that you like. But instead, our aim was to improve our life on the daily dentistry, okay? This is the group that we have been able to build in the last 6 years. At the beginning, we were just me and Pasquale. Now we have built a group with something like 20 members all over the world, and we have something like 65,000 followers on our group, on our page. So let's see in this brief webinar, why do you have to go vertical? Why vertical? I think that I am a good fit for talking about this topic because I worked for 10 years from 2002 to 2010 just with horizontal preparation. Between 2009 and 2012 I did the transition between horizontal and vertical, and I was working with both. And after 2012 I switched completely to vertical preparation. Boys, guys, the main point of vertical preparation is that it is easy. It's easiness, versatility, and it is patient proof. I did a lot of horizontal preparation. I started working with loops in 2004. I bought my first microscope, a Global G6, in 2006, already 14 years ago. And I was quite good doing horizontal preparation. This is something that I was doing 13 years ago in the molar area. This is one of my anterior preparation for shoulder for a ceramic adhesive crown. I started working also with minimal shoulder. Here I was doing a partial adhesive bonded restoration with the 0.3 millimeter shoulder. So you see that it's not the dexterity I was missing, okay? I was quite good in doing horizontal preparation, and I am able, and I do sometimes, to show amazing cases with horizontal preparation. The problem was not managing horizontal preparation. My problem was that horizontal preparation were not able to manage the whole of my clinical cases, because there are clinical cases that are so challenging to manage correctly with horizontal preparation. When we do horizontal preparation, we need to have a good view of what we are doing, and this is because otherwise we will use more of the half of our bar and we will create this sort of small notch, and this is a huge problem for many reasons. And instead, with vertical preparation, everything is much more easy, faster and predictable, even with the tough patients. Another point, soft tissue stability. A lot of people with zero experience on vertical preparation says that they are harmful for soft tissue. Instead, after 10 years of horizontal preparation and 10 years of vertical preparation, I have to say that there is no game, guys. Vertical preparation are much more soft tissue friendly. Look here, molar crown, close to the bone crest on the distal side because of a very deep decay. I have the full case, 2 years recall. 2 anteriors, 10 years, PFM on a premolar. Look the soft tissue and look about the stability of the soft tissue. 2 years, all crowns on the upper arch and the lower bridge. Look the stability after 2 years of these, 16 crowns, okay? Vertical preparation have a so good result about soft tissue, both health and stability. That's amazing. The bar protocol. I've worked for many years with the conventional bar together with my partner, Dr. Pasquale Venuti, but we have recognized along these years that there were some problems with the use of the old bar, the flame bar. So now we have moved to another kind of bar. We have started to recognize all the problems related to the use of that bar that was the active diamond tip, and all the problems like this one that the use of this bar was giving to us. There are many problems related to the use of the flame bar, and that we have been able to solve completely with the use of another bar. The minimal prep, because now with our protocol we are able to move from the conventional protocol, reducing the clinical problems that we have with the old approach, to a new protocol of minimal invasiveness, and we are able to save the whole dentinal core and all the enamel, and try to think about complications about sensitivity, endodontic complications about fracture of the abutment on the long term because of too much drilling, typical of the shoulder with big shoulder. Think to the ability to also be able to use adhesive because you have enamel on this teeth and not just dentin. You open completely another world of possibilities when you're able to shape a crown on a tooth, keeping all the dentin and the part of enamel. And last but not least, you see, I did this crown and I have enamel at 360 degrees. We have in Tomorrow Tooth, we have a full concept of the tooth preservation, both from the inner side when we do the endodontic access and from the outer side when we perform our crowns. And the last one, VertiCrown. We have been able to do crown with axial wall less than 1 millimeter to accommodate our kind of preparation when we perform the minimal invasiveness protocol. And to make these crowns thin and reliable, we did a new game about the lab approach. We have designed, together with my technician, Emanuele Tarash, we have designed a full protocol for managed vertical preparation. And this protocol is amazing both for conventional preparation and both, especially, for this new one, thin vertical crowns. This protocol now is available both for analogic and for digital workflow. We have developed new spacing strategy. The application of the spacer is a critical part in the managing of vertical preparation, and we have developed a completely new spacing strategy. We have seen that milling vertical margins is unpredictable, and we have developed precise milling strategies in order to improve stability and margin accuracy. And these are some cases that I want to show you briefly about what is possible now in a very easy and predictable way, and also in a profitable way, because when you do something quickly and in a predictable way, you become also more profitable. Look, this case before and after, this is recall, and look the soft tissue quality, health and stability. Another case, a very complex case with periodontal disease, before, intraoral situation, after, and final smile of the patient. So guys, welcome to the vertical world, and if you want really to jump on this train, come with us. Bye guys. From the founder, Marco Maiolino and Pasquale Menotti. The Tomorrow Tooth.